All right. So, looking at the next metabolic bone disease, this is what is known as osteogenesis imperfecta. Osteogenesis imperfecta. So for the osteogenesis imperfecta, this is just it. If you look at the word, is what osteo. Osteo means bone. Genesis means formation. Imperfecta means what? Imperfect. So if I try to arrange everything, just say that what? The formation of bone was imperfect. You understand? So we said that osteogenesis imperfecta is often called the brittle bone disease. So it's a rare genetic metabolic disorder. So it's characterized by bones that fracture very easily because your bones are imperfect. They are brittle. They are soft. All right. So the bones fracture easily, often with minimal or no trauma. So it is caused by mutations affecting type 1 collagen, which is a critical protein for bone strength and also bone structure. So what causes it is usually mutations in these two genes. All right, that's a collagen 1A1 gene or collagen 1A2 genes. All right, so these genes usually encode for what? Type 1 collagen. So these mutations can be inherited in an autosomal dominant or less commonly you have autosomal recessive pattern. All right, so key features is what? The person is having fractures very frequently. Often mild impact will result into a fracture. There's bone deformities, and such a patient is usually short. You can see that. Okay, so there's usually blue sclerae, so your eyes are usually affected. Hearing loss, your teeth are affected, so you have an imperfect set of teeth. That's dentinogenesis imperfecta. All right, there's joint laxity and muscle weakness. Okay, so you see this is scoliosis spine. Okay, so types of osteogenesis imperfecta is there are at least 8 recognized types. So the mild ones are from type 1. Okay, type 2 is actually severe. So each type actually varies in severity, age of onset, and also the associated symptoms you have. All right, but the first symptoms we listed earlier on is basically kind of like the floor level, but as it actually goes up, okay, it becomes more severe. So diagnosis is clinical features and family history. Has anybody had that problem in your family history? Then you can do genetic testing just to pick up these genes that are affected. All right, then bone density scans and also x-ray issues. So treatment is, why there's no cure, you just want to manage the symptoms. So bisphosphonates will help you to actually increase the bone density. Physical therapy will help you to actually strengthen the muscles and improve mobility. All right, orthopedic surgery will help you care for the fractures and deformities. Then hearing aids or dental care will also be needed, since those parts of the bodies are also affected. Why? Because they contain the collagen type 1 too, but the collagen type 1 is like more predominant in bones. So it's the bones that are like more affected because it's actually predominant in them, but it's also contained in other parts of the body too.